Welcome to Peterloo's Daily Dose, where we bring you the latest insights, stories and conversations shaping the future of general practice and primary care.
Welcome to Peterloo Medical Centre. So we've known each other for probably, 15 years plus?
Yeah.
From when you used to work in commissioning and management.
Yes.
And then you came to work over in primary care. So you wanted to do this podcast to have a discussion about a recent life-changing event and how you dealt with it and the significance of the diagnostics that you had. So tell us what actually started, how did it start, and what was the journey from there?
Okay, so a few weeks ago now, I was called for my first ever routine breast screening appointment. As is usually the case, I'm looking at the dates, wondering whether I should put it off for another time, because it's at the bottom of your list of priorities, isn't it? But I made the time and I went, and I'm really grateful that I did, because I went locally, just 10 minutes from my house. The staff were lovely, really looked after me. Had the mammogram, nothing painful or uncomfortable like some of the stories I've heard. It was absolutely fine, really well looked after. Left there, and the next day, funnily enough, I got a message to say they'd found something abnormal, but they obviously didn't know what that was. It could be something innocent or something that needs further investigation. So they called me in to go to Bolton, which is our main unit, breast screening unit for our area. Went there the following day at 11 o'clock, and it was fantastic. It was like a one-stop shop. So you go in the first room with the first team and you have more intensive and more detailed mammograms so they can look at the pictures more clearly. They still weren't convinced it was something they could ignore, but weren't sure what it was. So I hung around and went into the next team that were in the next room, and that team does an ultrasound. So I lay there and had the ultrasound. They looked at it, still couldn't just kind of write it off. They wanted to investigate more. So the third and final stop was the team that does the biopsy. So they took me in there. They gave me a local anaesthetic. I didn't feel that. I didn't feel any of the biopsy. Couldn't see anything. There was a loud click with the machine that they use where they take a little portion of the tissue. But other than the loud click, which doesn't affect you, didn't feel a thing. It was lovely. The staff really explained everything at each step of the way when I first came in and at each of the different stations. And before I left that afternoon, I already had a date in the diary to see the consultant so that when the results were ready, whether it was something innocent that they could just explain to me or whether there was further steps, at least I knew I had a date to see someone to discuss it and ask any questions.
So just up to there, at this point, from having the mammogram, the test, to you being told there's something abnormal on the mammogram, to you then going to Bolton Hospital to have the biopsy done, you were still working.
Yes.
Okay. And we worked together.
Yes.
So I know what was happening. You told me what was happening at the time. The bit that I was surprised with was the positive mindset he kept. I've been a GP here at Peterloo Medical Centre for 27 odd years now. I've seen women who have been on the same journey, and I know how traumatic mentally it's been soon as they get told it could be breast cancer. And yet you were really strong. You were really positive. What is it that made you that confident, that kind of not confident, but strong to get through this?
I think there were a couple of stages. I'll come on to the second part later, but for that initial part where I had the results to say there is something abnormal, I'm well aware, as most people are these days, that could mean it's anything. It could just be something totally benign that you don't need to worry about. You go and have the more intensive diagnostics and the job's done. And you go home safe and sound. But equally, you're very aware the importance of, if it's not, this is one of the most treatable cancers, isn't it? So if it's not, let's find out early. And we're on the road to recovery straight away. And that it was just seamless, that first part. So that gave me the confidence as well, because I knew what was coming, knew what to expect. And I'm a very big believer in don't worry unnecessarily, because I could have made myself ill with worry and then find out that it was nothing. So what would have been the point? Wait until someone gives you something to worry about first. But we know that even with the worst case scenario, there are plenty of options to talk through first. So you don't know enough to start getting worried at stage. It's in their hands, and that's what we're trained for.
With breast cancer, the timeline's very important. I've seen women who have had breast cancer, and the next thing they know is that it's spread because they left it too late to go for their mammogram. Whereas in your case, you went for a mammogram, it was the right time, it was a kind of an opportunistic finding. You didn't have a breast lump, you didn't go to the GP with a breast lump, it was just a coincidental finding on a mammogram, and that's where your journey started.
And I think throughout the journey, that's what I kept thinking back to, is the fact that I was very lucky. I was called opportunistically. It was my first ever one. So I certainly wasn't expecting it to find anything on my first one. You don't, do you? But how lucky we are in this country to have such a system like that picks these things up, because had this occurred 3 years later, it wouldn't have been picked up for another 3 years, would it? Or until I'd actually found a lump, and then, and obviously you know that it's still very treatable and things like that, but to catch it at that early stage, that first one, it's textbook, isn't it? It was absolutely the perfect case. I was in the best position that I could have been.
So you've had the biopsy done, you've been given a date the following week to come back for the results of the biopsy. What happened then?
So I went back to Bolton and saw the oncologist. He explained then that it was something abnormal. It was cancerous cells that needed to be dealt with. He did explain that it might not grow into anything significant, but that his view was that it's probably better to take it out and not have that chance. But they talk through the decisions with you and explain everything that entails. I felt very comfortable. And in fact, they commented on my positive attitude then. And there's a Macmillan nurse that's there, so they give you the number and you can contact them before the operation or afterwards. And they have a lot of advice for you. If you've got any concerns when you go home and questions that you didn't think to ask, you can contact them again, so you're not left on your own. And even they said it's quite a big diagnosis, and they were worried that it hadn't sunk in, of course, because of the work that you and I do and you. But again, everything that I was being told was so positive that, I didn't know there was anything there. Now they found something, they can do something about it. I can have the surgery, can have that removed, and hopefully everything goes smoothly. And that's the end of it. You didn't know you had cancer, and now all of a sudden you've not got cancer again. You're back to the starting point. So it was fantastic. And before I even left that day, I had my appointment for the surgery, and they even worked around a holiday that I had. As you know, I've got one coming up. So they got me in before the holiday with enough recovery time. Now, obviously, they can't do that all the time. It was fortuitous that they had a gap, but where they can, they work everything around a schedule wherever possible. It's really kind of tailored to you, and so supportive. I couldn't ask for any more support. It was a wonderful journey, to be as funny as that sounds.
But you were not the usual textbook breast cancer operation, life carries on scenario, were you?
No, you know me, I always like to do things a bit awkwardly.
So when they spoke to you about the operation options, starting with removal of the lump, a lumpectomy, that wasn't the only thing they discussed, was it?
No, they had to have an internal meeting with other clinicians, other specialists, to understand, because in my case, I have a rare autoimmune disease called microscopic polyangiitis. And if I have another flare-up of that, it can be life-threatening. So they're trying to treat me with kid gloves and be very careful with me, not to kind of disturb and allow this flare-up to happen. And one of the things that can trigger that is radiotherapy. Now, quite often the steps, as you know, would be that you have the lumpectomy. Hopefully they've got a wide enough margin and taken all the cells, but belt and braces, they just give you a bit of radiotherapy to kill anything that might be remaining, and they just feel more secure in the knowledge that they've done everything they can. They didn't really want to do that with me. And when they discussed it, they caught it early enough that it was absolutely fine for me to be able to miss that, because otherwise the fallback would have been mastectomy. And even with that, they were quite surprised that I didn't look startled at that, because I just thought, if that's what it takes, they support you, they can do reconstructive surgery if you want them to. It's very, very different these days, and you can get lots of things for your clothes, can't you, if you choose not to go down that route? And some people are just not bothered about hiding it at all. So they discuss all this with you, and I just thought, well, why would I want to preserve that, knowing that that could, at some point, this has the potential to endanger my life? If it's not there, I'm past the age of breastfeeding children and things like that. It's not like losing my arm off, something that I'm needing every day. I wouldn't notice it on a day-to-day basis other than cosmetically. And I think that's a fair price to pay to get that your health back in order. So I wasn't worried. Obviously, you prefer the lumpectomy. And after the discussions, that's the route they went down. So I felt very lucky in that sense.
So at that time, things like scarring, disfigurement, hair loss wasn't an issue because you weren't going to have radiotherapy. Those things went through your mind and you just positively managed it, or you didn't even think about things like disfigurement and scarring?
No, obviously you're aware of the disfigurement and things like that. And I did think that through, because at one point I phoned the consultant and said, is it my choice? Because maybe I want the mastectomy, just to put my mind at rest that there isn't anything left and we've got rid of everything. And we talked it through, and he said, absolutely, it's your choice. We can do that if you're going to be more worried. However, in your case, because of the size of it and these different clinical, the case surrounding my details, he didn't believe it was necessary, and the breast conserving surgery was the better option surgically for me as well. So I went with that. I had to have a kind of big discussion with myself before ringing and making that call. But was I aware of the implications of what I might be asking for there? And absolutely, but I just kept coming back to that point that I'd be fit and healthy. And, you know, money can't buy health, can it, in that sense? That whatever it takes, you need to do to keep healthy for yourself, for your family, for your friends. And that's your responsibility to take care of yourself, isn't it? So whatever those consultants, they're best placed to tell you, you've got to put your trust in them, haven't you?
So let's say you got to the day of the surgery. In the morning, you got your bag at home, prep bag for the day, you went. So what was the process from getting to the hospital to getting into theatre?
Again, a lovely bunch of people. They took me into the room. I had a bed. I didn't know where I was on the surgical list because I've been told I was last, and then someone told me, "Oh, we think you might be first now." So I had a bit of waiting around while they figured it out. In the meantime, the nurses got me comfortable on my bed, got me dressed into the gown, and explained everything that I should expect during that journey on that day. A bit later, the oncologist came round and explained his part, so did the surgeon, and even the anaesthetist. So they all came one by one, introduced themselves, introduced their role in the process, and explained exactly what I can expect, what I will feel and experience or not feel, as the case mainly was. So I felt very well informed going in. I wasn't nervous at all. Then I was taken down to the surgical room, and it felt very cozy. It wasn't kind of just very kind of harsh and clinical. It was more like being in a community consulting room. And they explained again everything that needed to happen. Really kind manner towards you, every member of staff. And to be fair, I remember him saying, I've just given you some pain relief that'll go through your system. And now I'm about to give you general anaesthetic. And I was expecting to be asked to count back, because that's what you see on the telly, isn't it? I don't remember if that happened. I haven't got a clue. I just remember him saying, in a minute, I'm going to give you general anaesthetic. That's all I remember. And then I woke up. I came round and there was a lovely lady waking me up, seeing if I was okay. And I felt like I'd had the best sleep ever. I just wanted to go back to sleep. And they were great. They took me back up. We went back up to the room and they said, if you just feel like you need to sleep, we'll just leave you. I think I slept for about 3 hours. And I came out, they explained everything that had happened. And when I was ready, they gave me something to eat and drink to make sure that was okay. In fact, I was quite greedy and asked for seconds, which they delivered on and got biscuits. And everything had gone smoothly. I was in no pain. I didn't remember any of the surgery at all. The last thing I remember was that gentleman saying that he's about to give me the general anaesthetic, and next minute I'm waking up. The site was not sore, it was tenderness. I knew something had happened there. It felt a little bit tender, but I couldn't say it was pain, not at all. And actually we had a good giggle. The nurses were lovely. We had a lovely chat and a giggle on the ward while I was waiting to be discharged.
And how long were you in hospital for before you went home?
Just a couple of hours. I took longer because I went back to sleep for so long.
Okay.
So I think I slept for 3 hours, and then they wanted to make sure you could eat.
So it was more a day case?
Yeah. Oh yeah, it was just a day case.
Okay.
I was in and out in just a few hours. So I went in, they want you there at 7:15 in the morning, even if you last, just so that they know they've got everyone there, they've explained everything. And the staff who are then going to be tied up with other patients doing your surgery have had a chance to come and lay any concerns that you've got and explain the procedure to you. So you need to be there to be able to have that time, one-to-one time with them. But then you're in and out and you don't know anything about it. And then I had to hang around because I was waiting for someone to pick me up. So I didn't go until tea time. But as soon as you come round and you're eating and you're feeling fine and the doctor's seeing you, you can go. You are given numbers to contact. They explain if any of these symptoms with the kind of redness and kind of untoward swelling, which they described to you really well, if you get any of the symptoms that they've listed, you just contact them again and they deal with you there. You just go straight to them. So they don't just leave you on your own. You're really well supported.
So another challenge for you was the fact that I know your mum supported you in this and she attended the hospital and she kind of provided support, but she doesn't live with you.
No.
And I know Bernard lives with you.
Yes.
And Bernard is not a person. Bernard is he's literally a small pony. I mean, what kind of dog is he?
An Irish Wolfhound.
So literally he's big enough to ride.
Oh yes, if he was sat here now, he'd be eye level with us.
Exactly. So post-operatively, having had the surgery, you had to make a decision for Bernard to go and locate elsewhere while you recovered.
Yes.
So he moved in with
my mum in Doncaster, because he's a big, powerful dog and he's still in puppy phase and gets excited to see you. He's 2, but because they've got so much growing to do, he doesn't finish growing until at least 3, so he's still in that boisterous puppy stage. 9 times out of 10, he's quite calm, but it would have just taken one knock while I've got the stitches in. It would have been painful and it wasn't worth the chance. He loves going up to my mum's anyway, so I made the arrangements that he wasn't there. If it had been a smaller dog, I wouldn't have needed to change anything. When you go home, you have to make sure there's somebody with you for that one night because you've had a general anaesthetic. So that's the same for any surgery, not specific to this one. But then after that, as long as you've been fine, you can kind of carry on as normal within reason. They give you exercises to do. You can't perhaps lift your arms over your head as easily as you might have wanted to start off with. I didn't really experience any of that, to be honest, the stiffness.
So did you manage with the solitary confinement, if you want, with not having Bernard, not having family, you being on your own at home, having just had breast cancer removed?
Well, you didn't give me a minute's peace and didn't check that I was okay for 2 minutes. So I didn't feel on my own. But it was quite relaxing, really, because I was still able to do everything. It's not like other surgeries where you're bedbound.
Yeah.
So you can do things within reason. You've just got to take it easy. You can't be lifting things around and thinking that you're kind of Superman. That just as long as you take it easy, it's fine. You can't drive for a couple of days until you're feeling more comfortable. That can be a week. It's different for different people. I left it for a week.
Okay.
Just to be on the safe side. But
And to be fair, it wasn't just me. I know a number of GP colleagues, good friends of mine, have all been ringing you to see how you're getting on as well.
Yeah,
and making sure you're well. And
support network, which is important at times like this. If you've got people around you that you can lean on, people that you can talk to about it.
Especially when it's a group of GPs and you can...
So that was helpful, yes. No, I think if you've got people that are around you, don't be afraid to lean on them and ask for some support. But in all seriousness, lumpectomy isn't that kind of surgery where you feel that you need a lot of support. It depends on your individual circumstances. It's a lot more painful. Like for me, it was a breeze. My only thing was that I had to make sure that I wasn't doing too much because of the added complication of my autoimmune disease. But for most people, they don't have that added complication. And it's quite a smooth ride. You just take it easy, make sure you get yourself right again. Within 2 weeks, you go back. The stitches are dissolvable, so there's nothing to be done. I went back. They checked the site just to make sure everything was healing correctly, and they were happy with it. The surgeon had a look, and he was happy. He described then the histology report where they looked to see whether they've got a wide enough margin that all those untoward cells have been taken away, and they confirmed that they absolutely had, and they were perfectly happy. There was nothing further for them to do. So now the last thing I have to do is go back in 6 months' time, have my final check-up before they discharge me, and then I'm back on a yearly round of screening. Then they just do it yearly just to make sure, because you've had that, that nothing comes back in that first couple of years, but then after that you're back to the normal cycle like everybody else.
So you had a landmark birthday in that period. You don't have to tell us how old you were. I know how old you were, but you had a landmark birthday. So that was really good news to know that the lump's been fully excised and that there's no thing left inside that needs further intervention.
So I don't mind saying it was my 50th, which people will probably work out from the age that you'll get called. But what a fantastic birthday present that was. I think that's the statement that I made, wasn't it? That I couldn't have asked for anything more. I went on my way home, I got myself a little birthday brownie, my own little birthday cake to celebrate that. You know, there's nothing else that you want on that day other than that news.
And how much time did you have off work?
So, people tend to have between, from what my consultant has said, tend to have between 2 to 6 weeks off. I think I've had 4. Obviously, with mine, they wanted a little bit longer. I think I would have been okay to come back after the 2 weeks, but because any additional stress after my body trying to get through what it's been through could inflame my autoimmune disease, we took a little bit longer, but that wasn't directly linked to the breast cancer diagnosis itself and the surgery itself. It's how my body responds to things, so it was just a little bit different for me. So I hear plenty of stories that they're fine after a week, 2 weeks. With me, I've come back to work my first day back.
So this is your first day back, yeah.
And obviously I just need to take it easy and not kind of try and do everything at once, and just let my body kind of get into that so that I can manage any potential for a flare-up. But again, that's kind of isolated to me and not the usual journey. But even with the added complication, everything's gone smoothly, hasn't it?
Well, I'm chuffed for you. I know a lot of my colleagues and friends are chuffed that your journey has been a smooth journey. Things have been picked up very early. It's not been traumatic. There's been no post-operative complications. And I think from what you're describing, the experience you've had of going to Bolton Hospital, Bolton Foundation Trust, and the way they treated you, the way they supported you, has made this, what could have been quite a traumatic experience, manageable, palatable.
Exactly. A big shout out to the breast screening team there, Naomi Duff's team, that they really make you feel at ease. They really explain everything. I came out feeling really calm, fully understanding the next steps. I had no gaps in that knowledge that I could sit and dwell on. And then through to the surgical team in the hospital itself, they're fantastic in the way they treat you. And if there's one thing that I really want out of this experience, is for other people not to be worried about going for their screening. I'm so thankful that I did. I didn't know I had cancer, like you said at the beginning, coming full circle. I didn't have any of the usual signs. I didn't have any tenderness. I didn't have the lump. It was just based on that routine screening. I would have never known that would have still been there growing, and who knows what might have happened in a couple of years' time when I'm called again in 3 years, what breast. And the fact that it was made so slick, so simple, everybody being so caring, that it just felt like a nice journey. And I actually enjoyed going to my appointments. And now the result, I've hit 50 and I'm cancer free.
But this is the thing in the health service. What the NHS provides the residents of this country, many other countries don't have that privilege. And when the national team look at a screening process, whether it's breast screening, cervical screening, bowel screening, they've gone through and worked out how many people need to have a screen to pick up a cancer. And they've justified that we need to put that as mainstream screening for all the eligible population. So really, if you get called up for screening, take up the offer. In your case, it was breast. The next person, it could be bowel. Next person could be cervical screening. I know at the moment there's a topical issue about prostate, and for men about prostate screening. But the national view at the moment is that prostate cancer is a slow-growing cancer, and there's a high risk that false positives may lead to intervention in a scenario that may not have needed the intervention that quickly. And that is why men are not being offered state screening blood test, as frequently as women would have cervical and breast stuff. But big shout out to you for keeping positive mindset, being strong, getting through this journey, and getting back to work today. So, welcome back. Welcome back.
Thank you very much.
So thanks for doing this, because I'm sure it's going to hit home with a lot of women who have concerns about going for a mammogram. You know, I've had feedback, kind of tales if you want. And I'm sure there'll be women out there who have had discomfort when having mammograms. Women are of different sizes, different departments. But it's nice to hear somebody who's had a positive mindset, gone through the journey, come out the other end with a strong, good, positive result.
Discomfort, no awkwardness, that made me feel really welcome and looked after. Genuinely couldn't have asked for a better experience. And my one plea to everyone is, please take up the offer. As you mentioned before, we're lucky to have it. The NHS are always trying to juggle money, and they have to decide on their priorities. And the fact that they're ploughing so much money into this shows what a high priority is and the importance of people taking it up. You could be like me, where you catch something that you never knew you had, and then you've got the all clear, cancer free at 50, live to tell the tale, and it was a superb journey. There's nothing to be worried about.
Well, thanks for coming down to Peterloo Medical Centre here in Middleton and doing the podcast. And we better get back to the day job.
I have, yes.